Great. Hi, everyone. Thank you for joining us again for our fourth Dementia Keys webinar. Today we will be looking at unplanned hospital admission and discharge, and we'll also be focusing on what to do if a non-COVID related hospitalisation is required, how to prepare for this eventuality, and provide information on discharge planning considerations. Please do ask any questions you have throughout the webinar using the chat box, or if you would like to ask in person, please raise your hand and I can unmute you if you want to ask questions that way. Once again, we are joined by Alexis Sobrano, Sweet Tree's Dementia Service Manager and Clinical Dementia Specialist. Hi, Alexis.
Hi, Helen. Thank you very much, and welcome everyone to our fourth week of our webinar series. Very happy to have you again, and for those of you joining us for the first time, welcome. Hope that you get some useful information out of today. So as Helen said, today we're going to be discussing unplanned hospital admissions and planning for subsequent discharge during the COVID-19 pandemic. So today we'll be providing practical information and advice if anyone faces an unplanned hospital admission related or unrelated to COVID. And also some information on discharge planning, which could be used in the post-COVID world. So a lot of the information that we're going to be giving today can be transferable, very useful now in particular, but hopefully you'll be able to take this information and apply it to any situations which may occur once life goes back to normal. So when we're talking about an unplanned hospital admission, especially now during the pandemic, we're talking about an admission that is either due to an acute medical crisis or an exacerbation of a chronic existing condition. So we would recommend that somebody's admitted to the hospital in these circumstances only if there's no other option. So if you've tried to call the rapid response team or the district nurse, your GP, other community providers, and it's unsafe to provide that care at home, then you'd be looking to enter hospital. It's really important to know your loved one's history and risk and really prepare for these eventualities. So if you know that your loved one, for example, has a history of urinary tract infections and delirium and has had multiple hospitalizations because of this, you would want to make sure that you're prepared, especially now during the pandemic. In addition to that, anyone with a chronic condition that has flare-ups, so to speak, that may need hospitalization, you may want to start thinking about these tips as well. How we categorize high risk at Sweet Tree has been really based on the government and medical advice. So for example, those with COPD, asthma, heart disease, certain neurological conditions, people with cancer who are undergoing active chemotherapy, people who have cancer of the blood or bone marrow, such as leukemia and lymphoma, people having immunotherapy treatments, people having targeted cancer treatments, people with diabetes, certain heart conditions, and others, as I said, with specific neurological conditions. So if your loved ones fall into these categories, you want to be especially careful that their medical conditions are managed so that you reduce the risk of them having to go into hospital during this time. So what we like to say really is having a plan is half the battle. So if you're prepared, that takes some of that stress off of you in the initial stages if there is an emergency and your loved one does have to go to the hospital. So as I said, if you identify that your loved one is high risk for hospitalization, especially now during the pandemic, there are a few things that you can do to prepare yourself to lessen the stress if an emergency occurs. For example, preparing a go bag. Now, we talk about this much like we talk about preparing that emergency bag for somebody who's pregnant who knows they're going to have to rush off to the hospital at any minute at the end of their pregnancy. It's really just being prepared to grab and go. And that's why we call it a go bag. So in this go bag, you can put, for example, a photo ID or recent photo of your loved one, personal information, an emergency contact form, which I will show everyone an example of later on in the presentation, copies of any advance directives, such as a do not resuscitate, copies of any private insurance that you have, a change of clothing, things that people need, such as glasses, hearing aids, maybe some hearing aid batteries, toiletries, name tags, and some comfort items as well, especially if your loved one has a dementia. You're going to want to make sure that there are some photos and comfort objects in that bag in the event that you can't be with them during this time. Other important information, such as the best way to communicate with your loved one, any triggers to any coping behaviors that they may display, their likes and dislikes, and what brings them comfort. Now, this is all, again, in the event that you can't be with them during this time due to the pandemic and restrictions that are placed in the hospital. And it helps the staff really communicate with your loved one and you as best as possible. What we don't recommend putting in this go bag are large amounts of cash, jewelry, wedding rings, electronic devices, things that you would really be sorry to miss. And as Helen said, at any point, if you have any questions about any of the information that you're getting, please feel free to raise your hand. She can unmute you, or you can use the chat box to ask us any questions. Preparing an emergency contact form and leaving it somewhere in the house is typically good practice if you're the primary care for somebody who has a dementia. Just in case something were to happen to you, for example, somebody could know where to go to get all of this critical information. Now, here's an example of an emergency contact form. I hope everyone can see it okay. And if you can enlarge your screen, maybe you could see it better, but Helen will send around the slides so you will have a copy of this. On the emergency contact form, you put information such as your loved one's name, address, telephone number, primary and secondary emergency contacts. If you're in touch with a care manager, either from an agency like Sweet Tree or a private care manager, you can put their information there as well. Your GP, a preferred hospital, your pharmacy, any insurances that you may use privately, a brief medical history of your loved one, and then very important medical information such as any serious allergies, specific instructions on diet. So if somebody's on a soft diet or a pureed diet, that's very important for people to know. If there's a wander risk, if your loved one has dementia, if there are do not resuscitate orders in place, and date of birth. Other information you would want to put includes current medications, dose, and any recent immunizations. On the back of the form, typically we put other important contacts such as a physiotherapist or other community contacts, neighbors, family members that you would want contacted if there was an emergency. Now, when we're discussing urgent hospitalizations that are unplanned, it's very important that we talk about delirium a bit. So delirium has two types, a hyperactive delirium or a hypoactive delirium. The hyperactive delirium is characterized by more increased motor activity, sometimes agitation, hallucinations, and maybe inappropriate behavior. On the other hand, a hypoactive delirium is really classed as a quiet delirium. So this is when somebody has reduced energy, lethargy, reduced motor activity, and it sometimes can be mistaken for someone just being a bit sleepy or a bit depressed. Delirium is really a sudden onset, lasts for hours, sometimes months, depending on the speed of diagnosis. It's an acute medical issue that occurs due to, for example, infections, medication interactions, organ issues, pain, bladder issues such as urinary tract infections, bowel issues such as not being able to use the toilet easily. And there are some predisposing factors such as dementia, frailty, and reduced mobility. Common features of delirium are impaired or changed cognitive function, so worsening concentration, for example, new or increased confusion. So if you're seeing an increased confusion in your loved one or a change in behavior that's very acute and rapid, you would want to rule out delirium. In terms of perception, you could see some visual or auditory hallucinations, which can be quite distressing for everyone. Changes in physical function, so perhaps somebody was very independent physically, and now they're not able to get up as easily. And changes in social behavior, so maybe lack of cooperation, withdrawal from usual daily routines, or changes in mood. So when we're looking at delirium versus dementia, as I said, the delirium is really a sudden acute onset, so a very rapid change, whereas a dementia, you typically see a gradual progression. With delirium, thinking tends to fluctuate, perhaps throughout the day, whereas with dementia, it's a gradual loss of cognitive ability. With delirium, somebody is likely to experience some paranoid hallucinations or delusions, whereas with dementia, that's typically not the feature of somebody's cognitive impairment unless they have, for example, a Lewy body dementia where hallucinations are part of the disease. And with delirium, someone may experience disturbed sleep, often involving the reversal of their sleep-wake cycle. Now, we do see that in dementia, but typically later on.
Alexis, is there a link between delirium and COVID?
So there is, especially with people who have pre-existing medical conditions. So if somebody were to come in contact or become infected with COVID, we know that older people may display symptoms of delirium.
Okay. Thanks.
And I know that there's quite a lot of information on this slide, so apologize for that, but Helen will send this out, so you will have this as a reference point. So if you can't avoid hospitalization, if something happens to your loved one, they absolutely have to go into hospital. It's very important to immediately tell staff about the dementia and be ready to explain symptoms of the event leading up to that hospitalization. Now, if you are unable to go with your loved one to the hospital due to hospital restrictions, it's really important to pass that information over to the paramedics. Specifically for family carers, there's potential guilt or anxiety about not being able to be present and expecting delays in communication. So what I recommend is trying to immediately identify a point person in the hospital, if that's a ward nurse or a nurse that you know is taking care of your loved one, or a discharge planner, potentially a physiotherapist, really identifying a point person in that team that's taking care of your loved one who you can communicate with directly. Most importantly, it's okay to ask questions. You know, for example, asking if the procedures that are going to be done or the treatment that's going to be done can be completed outpatient. So perhaps somebody's in the hospital for a few days and you like to try to speed up the discharge planning process. Ask what can be done outpatient. Is this absolutely necessary inpatient? Can regular medications be continued? And asking about potential effects of things like anesthesia, catheter placement, IV treatment, and how that's going to impact your loved one, and also the risks on the unit of COVID and procedures in place to safeguard other patients. So a lot of the hospitals are designating COVID wards, and so they're trying to keep people and staff as separate as possible. So you're going to want to understand what the risks to your loved ones are and what the hospital is doing to safeguard them. Another suggestion is to really be vocal. So let staff know immediately if there's any change. Ask family and friends to help make phone calls. So a lot of people are juggling a lot of different responsibilities at home, working from home, perhaps taking care of children or grandchildren, as well as taking care of their older loved ones. And so it's okay to ask for help during this time. If you need somebody to call the hospital ward and get an update on information or speak to the discharge planner, really you should allow yourself to reach out and ask family and friends for help. Asking the staff for more assistance is okay. I think a lot of us are really afraid to ask the NHS workers for a little bit more help because we know they're so stressed right now and it's been a very stressful time. But helping you get your loved one out of the hospital quickly also helps them in the long run. Just really ask any and all questions you have. Inform the staff of any prior issues with your loved one getting lost, any history of falls, or any past history of delirium. So if your loved one goes into the hospital for something related to a chronic condition and they don't have delirium, sometimes hospital admission can instigate a delirium, especially with somebody who has dementia, because they don't have their familiar orientation points. They may not be sleeping well because the hospital's so busy, or they're getting woken up at odd times for different medical procedures. They're seeing a lot of different faces, etc. So that can actually trigger a delirium, a hospital-induced delirium. So if your loved one has a history of delirium in the past, you're going to want to let them know. Other general tips that are not really exclusive to now during the pandemic is to post signs around the room. So if somebody's in an unfamiliar environment, they may have a difficult time, for example, finding the toilet. So you may want to put some signs up to help somebody understand where things are to maximize their independence in the hospital, so they're not just sat there not knowing what to do and becoming a bit more de-skilled in that time. Try and help the staff understand that they need to minimize background noise as much as possible, and go back to that emergency contact form and provide that to the hospital. And that's why I think that's such a useful tool, because you can put that in the go bag, and that's a form that the hospital can have on file, and they have all of that pertinent information in one place. for the hospital teams, and especially the discharge teams, getting robust information usually is most of the difficulty in planning people's discharge. So it's really important that all of that information is collated up front. And then lastly, planning for early discharge, especially now during the pandemic. If people are not seen as critical, they're really being pushed for discharge quite quickly. So it's really important from day one to start planning for what going home might look like and who you need to contact to make that safe for yourself and your loved one. So now we'll talk a little bit about discharge planning. And as I was just saying, it really starts at the point of admission. Discharge planning involves assessing someone's current, but also their future needs. So how do we get this individual home safely now, and how do we make sure they stay home safely? Repeat admission is going to put somebody at risk of developing further infections, perhaps that are going to be acquired in the hospital, or for a delirium if they are coming in and out of the hospital quite rapidly and changing their environment quite rapidly. That can be quite stressful. So you want to make sure that we're looking again at what does this person need now, and what will they need in 2 weeks' time, a month's time, 6 months' time to keep them at home safely. And now it's not only about the individual who's in the hospital, it's about the whole family unit. So how do we make sure that everyone's needs are taken care of so that this vulnerable individual has the best chance of staying home as long as possible and staying out of hospital? You want to get information such as who is the named discharge coordinator at the hospital and speak to them as soon as possible. Tell them you would like to phone into any planned discharge planning meetings. So if you can't be there in person, because of what's going on now during the pandemic, you're going to want to see if they can shift to telephone meetings and try to be as involved as possible in that planning process. Let them know what you're able to do, what you're not able to do, so that they can get resources to assist you as best as possible. It's important to agree a discharge plan with yourselves and the community-based team and within the hospital. So make sure that you know exactly what support you're being offered and that that is okay with you. And it has to be agreed by everyone. Before you leave, you want to make sure you have contact information of the community team. Now, in normal times, things get lost in the shuffle. Now, even more so. So it's very important to make sure that you have contact information so that when your loved one is home, you know exactly who to reach out to when you have a question or when you need assistance. You want to arrange any follow-up care, equipment, and treatment. For example, if your loved one is eligible for reablement at home, so that's typically about 6 weeks of some physio or some nursing assistance at home to help them transition back home, you want to make sure that you're looking into that and arranging that before somebody leaves the hospital. In terms of equipment, if somebody is being discharged and they need perhaps a Zimmer frame and they don't have that at home, you want to make sure that that's coordinated. Any follow-up appointments and any follow-up care that's needed, for example, with a physio, occupational therapist, or specialist in the community. Oftentimes, people will go home with some district nursing needs, so you want to make sure that those referrals are done from point of hospital as well. What's really important is not to let yourself be pressured into going home sooner than you feel is safe. So if you don't feel it's completely safe for your loved one to come home, there's a few buzzwords that you can use, such as this is an unsafe discharge. Really, the goal for everyone is to make sure that discharge from hospital is as safe as possible. And if you feel for any reason that it is unsafe, you really need to say that and help people understand where you're coming from and how to make sure that that transition is done safely. I'm just going to pause to see if there are any questions coming through, or perhaps if anybody has had this experience recently in the past couple of months during the pandemic of having an unexpected hospital admission or discharge in their experience.
Raise your hand or put a message in the chat box if you'd like to say anything.
Okay. So I know for us at Sweet Tree, we have helped a number of people come home from hospital in the past 2 months, either with a COVID diagnosis or without. And what we're finding is that we have to be in contact much more frequently, with the hospital teams, because they are so stretched. The resources are very stretched. So we're acting really as a backup discharge coordinator and making sure that all of the different people involved are in communication, that families understand what's going on, and that we can help people transition home safely with support. As I was saying, it's really important to advocate for referrals to be made from the point of being in the hospital. Sometimes it's a bit difficult to get in touch with the GP to have them make all of these different referrals. So typically we ask in the hospital for those to be done, such as a speech therapy assessment, occupational therapy assessment, or physiotherapy assessment. Now, usually that's done in the hospital a bit early on, and then could be done in the community again as things progress and as your loved one recovers. So with speech therapy, they'll be looking at things typically like swallowing and communication. Occupational therapy is looking at the safety of the home relative to somebody's mobility and range of motion and how they navigate their environment and their activities of daily living, such as getting dressed, going to the loo, making a meal, making a cup of tea. Physiotherapy is really about strengthening and getting somebody's mobility back as close to baseline as possible. Never ever leave the hospital really without a copy of the finalized discharge plan, and verify with your GP that they have received a copy. A lot of times everyone's running around super busy, and that is really easy to get missed. And so that's something that's really important that you have physical copy of, and again, verify with the GP that they have that as well. Sometimes some certain medications are changed or discontinued in the hospital, and it's really important that your GP has that information so that your prescriptions in the future match what you should be having.
Alexis, I have a question here. Somebody's asking about, due to the NHS situation and everybody under a lot of stress in the hospitals, is there the danger that people are going to be discharged prematurely when they shouldn't be? Do we need to ask questions, specific questions about that before they are discharged?
Yes, that it always is prudent to ask questions about why the decision is being made to discharge someone, and having the hospital staff be very explicitly clear about why they feel it is safe at this point to discharge someone home. Perhaps, as I said earlier on, perhaps there are treatments or procedures that can be done outpatient, and they've decided now during COVID that it's lower risk for somebody to be home and receive that treatment at home than in the hospital setting. And those are conversations that you should be able to have openly with the hospital staff.
Right, thank you.
So another facet of discharge planning is really making arrangements for social and healthcare support, including informal supports. So when we're talking about making arrangements for social and healthcare support, we're talking about reaching out to local home care agencies who can provide you a bit of help and respite potentially at home, or even informal supports such as looking into the Alzheimer's Society or other organizations and what kind of support that they can provide on a more informal basis. Volunteer organizations, reaching out to friends and family, looking at where you can receive as much support as possible. And there, as I said, the discharge planner should be giving a lot of this information. They should be giving a lot of resources and services in your local area that could help you transition at home and feel supported at home. Going home from the hospital can be quite stressful, especially if there are significant changes in the functioning, either cognitive or mobility function of your loved one. So it's important that you know where to turn when you need a bit of extra support, potentially where to turn if you just have a question about medication, or to feel that you need support in helping your loved one get from their bed to the sitting room and want to make sure that you're mobilizing them appropriately. You just want to know where to turn to get that information and to get some reassurance that you're doing everything that you need to be doing. So in the slide here, I've put a link for some NHS guidance on being discharged from hospital. So really what you can expect, what you're entitled to in that discharge planning process, and that way you can advocate for yourself if people aren't doing things exactly as they should. specifically related to the COVID pandemic, there has been some guidance released that everyone leaving hospital should be tested for COVID-19 and not leave without a thorough plan around this. Now, this means really risk to others at home if they're living with other vulnerable loved ones at home, and having an appropriate care plan in place. So specifically, it says all patients being discharged to a care home as well will be tested prior to discharge to ascertain their COVID-19 status. So if your loved one is living in a communal situation in a care home, they should be tested. And where trusts have the capacity, consider testing patients prior to discharge if they required critical care, are severely immunocompromised, or any member of the household is extremely vulnerable and shielding. So if you feel that your loved one needs to be tested for any of those reasons prior to leaving the hospital, you should really speak to the hospital about this and explain your position on why you feel them coming home without that testing would put others in the household at risk. And again, I've just put the link here to that guidance, the government guidance, so that you can look after the session. Now, any questions coming through on that? No.
Not at the moment, no, but please do feel free to send any through or raise your hand.
And what I want to highlight about the COVID status testing coming home from hospital is that what we've seen with a lot of our clients is that they are being tested before coming home because they are in the extremely vulnerable group, or they live with a spouse or other family members that are vulnerable as well. And so the hospitals are doing that testing before people are discharged. Okay. Well, hopefully everyone got a bit of information that they find useful, not only for now, but for post-COVID when everything goes back to normal. At Sweet Tree, we really do focus on getting our clients and home from hospital as safely as possible and really work with the hospital team. So we do have a lot of experience with discharge planning. So I hope that everyone who listened in today will feel comfortable reaching out to us. You can go to our website, you can give us a call, and we'd be happy to talk you through any questions that you might have. Even if you don't have questions now, if you find yourself in a situation where your loved one is admitted to hospital and you want some support, we'd be happy to talk you through that.
And I will be sending out all of the slides from today to your emails later today, so look out for those, and please do share with anybody else you think would benefit from them. There'll also be the link to tune in next week, where there'll be the 5th session where we'll be looking at general question and answers and future planning. So hope to see you there. Thanks very much, and thanks, Alexis.
Thank you.
Thank you.